Good afternoon, and thank you so much for participating in today's webinar. This webinar is the first in the 2016 Winter Webinar Series, 21st Century Student-Centered School Nursing. The framework for 21st century school nursing practice sets forth key principles for student-centered care. A principle that encircles all of them is the standards of school nursing practice. Today our panelists are Beth Mattey, NASN President, and Libby Thomas, a school health consultant. Thank you, Beth and Libby. So let's get this discussion started. Beth?
Well, thanks, Margaret. It's so good to be here today, and especially with Libby Thomas, who really is truly an expert in this area. Today, our objectives are that we want you at the end of this webinar to be able to identify a school nursing activity demonstrated as a component of the principal standards of practice in NASN's framework for 21st century school nursing practice, and identify essential publications necessary for all school nurses. I'm going to start out by giving you a brief background in the development of the framework. Like I said, I'm so pleased to be here with Libby Thomas because she truly is an expert in standards of practice. And what I wanted to share was, as a school nurse for 28 years, our practice has changed. I've seen it over the years, and I'm sure many of you have as well. The needs of our students are much more complex. We have the greater needs among our students. We are seeing what we call the social determinants that will really impact our students' health. These are the factors that school nurses address every day when caring for kids. It's the student that is unable to access care because they can't get transportation, or the child that doesn't have, the parent that doesn't have money for a copay. Maybe a child is food insecure. There are many, many reasons that there are barriers to care, and school nurses help to address those cares, and we're seeing it more and more. The specialty practice of school nursing is very broad and is dependent on the needs and concerns of our school population. In addition, healthcare reform has increased the focus on community-based and coordinated care where we can work in teams, and also using technology to communicate between families, the healthcare providers, and the health department. In addition, when we were looking at frameworks, there have been frameworks over the years, and perhaps maybe the one that most of you are familiar with was Susan Wald's framework from 1981. It was organized around priority concepts, public health, systematic process, tools, adaptation, and helping relationships. But NASN thought that it was really time for a new framework. So when you're talking about a conceptual framework, we're looking at a set of concepts linked together in a distinctive way to provide guidance for achieving an overall goal. And really this set of concepts really kind of describes how our framework for NASN was developed. But one of the things that happened is, you need to have basic assumptions in your practice to develop a framework. And these were the assumptions that were basic to school nursing. School nursing is a specialized practice of professional nursing that advances the well-being, academic success, and lifelong achievement and health of students. It's a dynamic profession that changes to meet the current needs of students and school communities, while still maintaining the underlying principles of the nursing process and evidence-based practice. In addition, school nursing is a collaborative practice. School nurses are leaders using their expertise in health and education and linking health and education. Most school nurses are the only healthcare provider in the school setting, so we must be able to use our critical thinking and the decision-making that is so critical to good decisions. We focus on the school community, which is defined as the individual student, the family, and the community at large. We don't just practice within the walls of our office. We are rooted in public health. That's our roots, and we still are grounded in public health principles. And nurses as nurses, we have a core set of values that reflects our integrity, our accountability, and our responsibility for ethical practice. So, using this as a background, as NASN was evaluating needs assessments and getting ready for programs and planning for programs, they noticed themes were developing as they were preparing for these programs that were consistent across the framework, which then led to the development of the framework. They put it together and talked to experts in the field on frameworks and developing frameworks, and then put it out to the experts in the field. The NASN Board of Directors examined it. You may have been called upon to look at the framework as an expert in school nursing, and your advice was really very much appreciated and taken into account. A draft of the framework was published in July in NASN School Nurse, and we solicited more input, and we certainly got it, and we certainly appreciate it, and we were listened to. And this is the framework that we now have, the framework for the 21st school nursing practice. The NASN Board of Directors approved this framework in October, and we are very, very happy with the way it's developed. You know, the one thing that's so important to me is that the child is in the very center of our framework. When you look at this, you'll see the child right in the middle. We want the child to be healthy, safe, and ready to learn. And then surrounding the child, or the students, or our students, are the family and the school community. Also very important when we're looking at a child and their well-being. Surrounding this are the 5 key principles of practice. The outer circle, the standards of practice that we'll be discussing today, will be surround and are interwoven into all the other key principles that are within the circle. There's care coordination, leadership, quality improvement, community, and public health. But for me, this framework provides structure and focus to what I do every day. It demonstrates the very broad scope of school nursing practice. When somebody asked me what does school nurses do, a million answers used to float through my head. I mean, they didn't float, they buzzed around. Well, I do preventive care, I coordinate care, I work to prevent illness and injury, I educate, I make sure children are immunized, I remove barriers to care. I just couldn't say it all fast enough, and then I couldn't get it out to convey the depth and breadth of my role. Using this framework helps to articulate our role beyond the task of school nursing. As you can see, the key principles that I mentioned earlier are listed here in columns, 5 columns across the page, and underneath each of those columns are components of our practice. It helps to further define what it is that we do. But today, we're going to focus on the standards of practice. Remember that the circle that surrounds the child and the school community and the other key principles, and is interwoven into everything that we do. And with me, I mentioned earlier, is Libby Thomas, who, like I said, is an expert in the scope and standards. Libby was an author for the 2005, actually she was the chair of the committee that wrote the 2005 School Nursing Scope and Standards, and again was an author in 2011. In 2015, Libby chaired the revision of the ANA Scope and Standards of Nursing Practice. She also was an author to help write the Code of Ethics for Nursing that was released in 2015. All 3 of these documents are important to school nurses and our practice. In addition, not only is Libby an expert in writing scope and standards, Libby was a school nurse in Delaware for 28 years and is now a consultant and a mentor director. She runs a mentoring program in Delaware, and we're just delighted that she's here with us today. So, Libby, I'm going to turn it over to you and ask you to explain to us just what is the scope and standards of nursing practice and why is it important?
Thank you very much, Beth, and thanks for inviting me to be here today. Well, the American Nurses Association says that every profession has a duty to its members and the public both to define itself and its scope and to present those findings to the public. To be clear, there are two scope and standards documents that you've just shown that school nurses have responsibility to. The first, Nursing Scope and Standards of Practice A&A 2015, and the second is the specialty, our specialty, School Nursing Scope and Standards of Practice, written in 2011, and is currently under review, chaired by Dr. Cheryl Risha. All registered nurses are responsible to all standards and competencies written for the registered nurse, and all school nurses must meet both those standards and the standards of school nursing practice. The scope itself is the full range of nursing practice common to all nurses that includes quality, evidence, and safety. Who are we? What do we do, and why do we do it? Our scope tells us that. It tells us the who, the what, the where, the when, the how, and the why of school nursing. Look in that scope to be sure you're practicing within the established scope of a school nurse. NASN uses the American Nurses Association published scope and standards for all nurses as a template when writing our document. Specialties are all invited to use this document to define and clarify their own specialty. Standards themselves are authoritative statements describing competent school nursing care. Under each standard is a list of competencies that can be used to measure the school nurse's success at meeting a standard. Competencies themselves are listed below each of the standards. These help the nurse evaluate their own progress in meeting the particular standard. All nurses must, I'm sorry.
Well, I had a question. Do the scope and standards apply differently to the new nurse versus the expert school nurse?
They do. We have actually categories, but besides the categories of competencies, every standard is met by every nurse based on their experience, their education, and their position. So someone who was a brand new nurse straight out of nursing school with a couple of years experience and walking into the school nurse's office one day to take over is not the same, going to be held to that same accountability as, for example, you are with your experience.
Okay, thank you.
You're welcome. Competencies, as I said, are listed below each of those standards so that the nurse can self-evaluate. And the standards are written in a broad way so they can be interpreted individually for those individuals, just as you said. They're also pretty useful. They can be used for writing evaluations and job descriptions, informing others of what we do, helping to establish legal standards of care in court cases, and for writing agency procedures and protocols. They're pretty handy, actually. Now, here are the standards of practice. We have a whole lot of standards, but the first 6 standards are the nursing process, as you see right there. They're assessment, diagnosis, outcomes identification, planning, implementation, which includes coordination of care, health teaching, and health promotion, and evaluation. Now, this is a bidirectional feedback loop, not linear as it's listed. A nurse may have to stop and go back to any one of the standards at any time in the nursing process. And this little person is so enjoying a little asthma treatment, I think. Yeah, Beth, Beth, do you have an example of using the nursing process?
Well, sure, and I think all school nurses can identify this. It's just so, the nursing process really is so basic to what we do that sometimes we don't even think about it as we go through the steps. I know the minute a child walks into my office, I'm checking them out and I've started my assessment. I'm looking at them. And, you know, are they breathing okay? Is their color okay? Do they look okay? And so the child that comes in, if I know he has asthma, so I'm going to focus in on his asthma. And he tells me that he's having difficulty breathing. So then I'm watching, you know, does he have nasal flaring? Is he using one-word sentences? Can I audibly hear wheezing? And then I'm going to go further. You know, I'm going to do more of an assessment. I'm going to listen to his lungs, do a peak flow, perhaps an FEV. And if the child is wheezing, obviously I identified that he's got an ineffective air exchange and I need to do a little bit more. Now in my planning, in my previous planning, I knew that he did have asthma. I have asthma medication for him. We have an asthma action plan. You know, I reviewed the asthma action plan, and he's not in a great deal of distress, but he does have some wheezing, so I will give him his medication. And then at that point, then, I'm going to listen to see the effectiveness of the medication. So, and find out, is this the first time that he's done this? Do a little more of a history. Is this the first time he's using his inhaler this week? Has he been using it for a while and not on a maintenance medication? Of course, I need to contact the parent and kind of communicate with them and find out what's happening. So it's an ongoing loop, just as you say. We're constantly evaluating, assessing, reevaluating, and planning.
As Beth was talking, I heard her meet the following competency as well as many others under assessment. The one that came to mind is the school nurse uses appropriate evidence-based assessment techniques and instruments and tools. Beth, as an experienced nurse with a graduate degree, brings a high level of skill, knowledge, abilities, and judgment, and a strong intuitive sense to her care for their students. You'll find many competencies listed for both the general school nurse and additional ones for graduate level prepared school nurses and APRNs. So there's another kind of standard, and they're called standards of professional performance. These standards describe a competent level of behavior in our clinical role. They very clearly list professional expectations. The list is ethics, education, evidence-based practice and research, quality of practice, communication, a standard of leadership and collaboration, professional practice evaluation, resource use, environmental health, and one very unique to school nursing, program management. These standards are also met appropriate to the school nurse's education, experience, and position, with accountability first to self, then to the healthcare consumer, who is our student and family and community, then to the profession, and then to society itself. So within the scope and standards of school nurse practice, let's take a look at Standard 11, leadership. The school nurse demonstrates leadership in the professional practice of school nursing, school health, and other professional organizations. How do you meet that competency, Beth?
Well, you know, I've always been a member of my professional organization, and I joined particularly for the education and for the continuing network that it provides. I know many NASN members have commented how valuable they've found the NASN discussion forum has been for them, you know, the discussion where NASN members get together. And of course, because I believe that better health means better learning, I want all children to have access to a full-time school nurse. So by joining my professional organization, that was a way that I could make it happen. And of course, I loved it, and I continued on and stayed very involved and actively involved with them.
And I hope all our listeners today are also NASN members. Competency under leadership for the graduate level prepared nurses and APRNs is the school nurse shapes the direction of the specialty by actively engaging in such initiatives as development of standards, competencies, role definitions, position statements, and clinical guidelines. So this leadership standard is describing competent professional behavior of someone with advanced knowledge, skills, and judgments. The expectation is, however, that the school nurse will contribute to the profession. That looks like a pretty lofty goal for lots of us.
And here we have our scope and standards again. And then I believe one of the others that we're going to address in a minute will be the code of ethics for nurses.
Correct.
So the framework offers examples of the work school nurses do daily to optimize student health and learning, and I think that you've heard that as we've described some of the scenarios put forth. But there's more to the standards, and I briefly mentioned them earlier. Under each of the key principles, we have components, and here are listed the components of the key principle standards of practice. Libby, how do you see these components fitting into this principle?
I think they fit wonderfully well. In our framework for the 21st century of school nursing practice, I see standards of practice as a principle itself, surrounding principles of care coordination, community and public health, quality improvement, and leadership. The standards of practice principle includes additional components to further strengthen that scope of school nursing practice and give it more substance. The components of the circle protecting and promoting school nursing practice include important documents, that's for sure. The scope and practice and standards of practice for all nurses is joined by nursing social policy statement that's found in the new 2015 ANA document and the Code of Ethics. These three have been called the foundation of nursing practice for lots and lots of years. When you add to that our school nursing scope and specialty, that adds a high level of competence for school nurses. And as the framework was developed, other components were added to support and continue to strengthen that framework. Clinical guidelines reflect evidence-based practice. This improves health consumer care. Critical thinking is certainly a part of evidence-based practice. They're earmarks of school nursing. State nurse practice acts and regulations further define practice. Certainly, position statements written by expert school nurses who are your colleagues influence quality, safety, and care. Each one of those is part of the principle, and each can be included in the standards of practice.
And I showed the document, the Code of Ethics, earlier when you were discussing the professional responsibilities. And in 2015, the ANA sponsored the Year of the Ethics for Nurses. And I know you were an author of the Code of Ethics for nurses. Can you give me an example of an ethical situation we might encounter as a school nurse?
Oh my gosh, there are lots and lots of ethical situations that school nurses run into. How about, what do you think? I don't know. Let's consider peanut allergy. Does a student with peanut allergy perhaps have some ethical issues?
Well, you know, what happens, we need to make sure that we're planning for a student so that we're advocating for the student, making sure we have an action plan, educating and collaborating with the student, the family, the school staff, ensuring that we have medical medication available in the event of an exposure, and of course that we're advocating for a safe environment where exposure to peanuts is monitored and limited. So I guess, you know, that covers, you mentioned number 3, and I don't think you explained all of that. I didn't give you time.
Provision 3 says the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. So we can certainly apply that provision as we care for that student. When you look at the Code of Ethics, it's roughly divided into 3 sections. There are 9 of provisions, and under each provision there are interpretive statements. We all should read that very carefully. It has lots of important things about work environment, about workload, about a lifelong learning. It's really kind of an exciting document.
Well, Libby, you also spoke about evidence-based practice as a component in standards of practice. You know, NASN developed the clinical guidelines for asthma to help nurses practice using the latest evidence, and they're available on the NASN website. You know, I always feel it's our responsibility to make sure that we are providing the best care for our students, and I believe that's part of our standards of practice and our ethical responsibility. But that also dovetails with the component of clinical competence. I know as an independent practitioner in the school setting, I want to be sure that my skills as a nurse allow me to provide the best possible care to my students. So clinical competence and continuing education are extremely important to me.
And they're part of your Code of Ethics, your personal Code of Ethics.
Yes, you're right. So, and then I have a picture here of our NASN position documents. As Libby mentioned, their position statements help school nurses to in their practice, and they're available on the NASN website for members and non-members. School nurses tell me they refer to them frequently when they have a situation arrive in the school setting, or they use them to help develop and enforce policies in their own school district. NASN has a new position document, naloxone use in the school setting. Nurses are referencing this document as we see naloxone now as an emergency medication in the school nursing office. Really important document. So I hope that the information that we've shared today will help school nurses understand how they can use the framework every day in their own practice. As I mentioned in the beginning, it gives structure and focus to what we do every day. Our role is much broader than the task of nursing. And I certainly appreciate Libby's expertise and her contribution to the discussion of the key principle standards of practice. It really helped. I think it helped others to understand what we're talking about when we say that it's interwoven throughout this whole framework. If you would like more information on the framework, you can check out the January current issue of the NASN School Nurse. There's a nice article in there about the framework. Of course, it's available on our website at the address shown here on the screen. And also, there's a podcast available. Erin Mon talked with the editor of NASN School Nurse, Cynthia Gailmore, about the framework and what it means for school nursing and how it can be used. I do have a reference page for you, and I believe Margaret will describe for you how you can access the slide deck after the presentation. Thank you.
Thank you.
Well, thank you so much, Beth Mattey, NASN President, and Libby Thomas, a school health consultant, for this very informative discussion about the framework for 21st century school nursing practice. All attendees will receive an email with a link to the slide deck and recording. And one final note, NASN's annual conference will be here before you know it. NASN 2016, Learning, Linking, Leading. Start planning to attend NASN 2016 in Indianapolis, Indiana by setting aside some time to attend. Visit nasn.org/NASN 2016 to access the attendance justification toolkit. This is Margaret Salucci, NASN Director of Communications, and on behalf of NASN, thank you so much for joining us today.